How the active ingredient in Sublocade, buprenorphine, works. Sublocade, buprenorphine injection for subcutaneous use, C3, is indicated for the treatment of moderate to severe opioid use disorder in patients who have undergone induction to suppress opioid withdrawal signs and symptoms with a transmucosal buprenorphine-containing product. Use Sublocade as part of a complete treatment plan that includes counseling and psychosocial support. Medication-assisted therapy, or MAT, is the use of FDA-approved pharmacotherapy for treatment of opioid dependence, addiction, or opioid use disorder, OUD. Psychosocial support, in addition to MAT, has been shown to improve outcomes for opioid dependence. MAT has been shown to be effective. Buprenorphine is one example of MAT. There are 3 classical opioid receptors, the mu, kappa, and delta opioid receptors. The addictive effects of opioids are mediated by the mu opioid receptor, making it a target of interest in treating OUD. There are 3 categories of ligands that produce different mu opioid receptor responses: full agonists, partial agonists, and antagonists. Full mu opioid receptor agonists maximally activate the receptor with increasing drug concentrations, while partial agonists activate the receptor, but their ability to activate the receptor plateaus with increasing drug concentrations. Antagonists block mu opioid receptor activation. Buprenorphine is a partial agonist of the mu opioid receptor. Increasing buprenorphine concentrations do not fully activate the receptor. As a partial mu opioid receptor agonist, buprenorphine has less maximal euphoric effect, a lower likelihood of producing respiratory depression, and a lower liability of physical dependence. As well as being a partial agonist at the mu opioid receptor, buprenorphine is also an antagonist at the kappa and delta opioid receptors and an agonist at the nociceptin orphanin FQ receptor. Buprenorphine has a strong affinity for the mu opioid receptor. Once bound to the receptor, buprenorphine is not easily displaced by full agonists, including heroin, morphine, hydrocodone, oxycodone, and hydromorphone. With our understanding of the addiction cycle and our understanding of the use of buprenorphine for medication-assisted therapy, HCPs have more choices to help patients throughout their treatment journey.